speak to such a diversified audience. Well, recently I submitted an article that's going to be published in the next edition of the McGill Journal of Medicine. And this article is entitled Medical Leadership, Doctors at the Helm of Change. Why did I write this article? Well, I've always been very curious in learning more about the management, the functioning of our healthcare system, as Russ was saying. But also, more specifically, I wanted to know who are our leaders here in Canada in the healthcare system. So, by doing a survey of the literature, I came up with a few key elements, and two were more striking for me. First, that there's really little that's been written on the topic of medical leadership. And second, that there seems to be a great need for a new generation of fully trained leaders, physicians that possess both clinical skills and leadership skills, and that in order to face the current issues in healthcare around the world. So during my short presentation today, I'll try to offer a very humble first-year medical student perspective on medical leadership. And I'll start by targeting a few issues in Canadian healthcare, to then see how medical leadership can be applied worldwide. I'll then move into the different levels here in Canada where we can find medical leadership and what that can bring to us. Finally, I'll wrap up by just talking about a few promising Canadian initiatives and a few solutions. I know we had a presentation on medical leadership by Dr. Moore this morning, so I'll definitely try to offer a different perspective. Definitely coming from a student will be different. So if we have time, we'll also finish with a short discussion and question period at the end. So let us start. So when we think of issues in Canadian healthcare, we often think of aging demographics or rising costs, or the very complex bureaucracy that surrounds hospital care. But there are also more specific issues targeted to leadership in itself. For example, many leadership positions are held by non-physicians here in Canada. And most of the time, administrative roles are considered by physicians as an extra burden, an extra task, and they often offer little recognition or little incentives. At least that's what I found in my research. And then there seems to be a lack of CMO positions. I'll go into more details of that later on. And then there's very little space offered to management and leadership skills in university medical curricula. So more and more countries in the world are starting to offer more opportunities for doctors and physicians to take a more active role in leadership and the administration of healthcare. Countries like the United States, Denmark, or the Netherlands, although having very different healthcare systems than ours, are creating more and more of these positions for doctors to take part in the active change of their systems. A very good example comes from the United Kingdom. Over there, the NHS, which has been presented this morning, created at the beginning of last year a document called the Competency Framework. This document is a key document explaining what are the key qualities that should be possessed by all doctors undertaking leadership roles, but really of all doctors in their training. And at the center of 5 key qualities, we found the ultimate goal, the delivery of a service, healthcare. So what are these qualities? We have personal qualities and professionalism, the ability to work with others, setting direction, of transforming services, and finally, the ability to manage a business. When we hear these terms, we might be tempted to think, well, these are just general leadership skills. Well, yeah, they could apply to any area, any domain, really. But when they're allied with strong clinical skills, they provide the basis of what can offer doctors the power to bring change in good medical leadership in healthcare. So coming back to Canada now, where do we find medical leadership in our healthcare system? Well, the story starts very early with application in medical school. In my research, I found that 3 key qualities bring students to get more involved into leadership later on. And these assets are having a vision, the ability to sacrifice, and courage. However, if we take these 3 qualities and we add a goal of efficiency and profit, there seems to be a conflict between more traditional values associated with healthcare, such as empathy and care. Are these 2 sets of qualities possible? Is it possible to seek to be efficient, but then to be caring for your patients? Well, that's exactly what the role of universities should be in their curriculum, to develop a combination of these 2 key competencies in order to give doctors the power to bring change in a positive way. And I've seen that there seems to be a very big lack of leadership training in universities, especially here in Canada. As students become physicians, they learn to manage and to be managed. We all know that doctors don't work alone. They're surrounded by nurses, technicians, physicians, so they always work in this context of teamwork. And for them, having leadership abilities and being a role model for their team is essential. It's also very much a very big advantage for doctors to have a strong emotional capacity, being able to self-manage, to be self-aware, and to be socially aware. But how is this possible for doctors to gain these abilities if they don't already have them, unless they're offered ongoing leadership training? And once again, it appears that there's very little training that's offered to practicing physicians. And it does become even more important for doctors who wish to undertake additional leadership roles. So that brings us to the next level, the executive level. So in the upper structures of our healthcare system, so in hospitals or healthcare clinics, there are two broad categories of positions. You can see chief executive officers, mainly directors, and chief medical officers. These two different categories of managers have different tasks and different roles. But basically what we see in Canada is that there has to be chief executive officers at the head of each hospital, but very often they're not necessarily physicians, or they don't necessarily have clinical experience or professional experience in healthcare, and that there seems to be a very limited number of chief medical officer positions, which makes it all the more difficult for the upper structure of the management to relate to the healthcare employees themselves, creating a sort of disconnection between the two. And that's something that I think should definitely be addressed and improved on for the future. And finally, when we consider our health ministry as a whole, the health minister appears to be the key player. He definitely needs a good understanding of healthcare and the people working under him in order to bring change in this beginning of the 21st century. There are some very good examples of countries and provinces that are starting to acknowledge the need of having doctors or clinicians at the head of their ministries. Countries such as Germany or the United Kingdom, and here in Quebec have stepped in that way. We've seen that our current and past health ministers are both very experienced physicians, and we're very lucky to have Mr. Philippe here, Dr. Philippe here today. But there's still many countries that seem to ignore this need of having more experienced physicians in their upper structure. So a few promising initiatives. Well, this morning we saw the presentation of a master's program here at McGill for Dr. Moore. There seems to be a very good initiative to bring more qualified leaders in the domain of healthcare. There are also three other very interesting initiatives that I found in my research. So since 1985, the Canadian Medical Association, through its Physician Manager Institute, is offering core leadership program for both students and doctors. The only problem with this training is that it does cost a lot of money, and it offers very little incentives in the end for the ones who undertake it. Closer to us here at McGill, the MD-MBA program can be seen as a very promising program to offer both full management training and the obtention of a medical degree to students coming from an undergraduate degree. How is this program going? Well, at first, I conceived for about 5 or 6 students every year. The class of 2011 and 2012 actually have 2 students enrolled.